Arizona has emerged as the latest epicenter of the coronavirus here in the U.S. The number of virus cases spiking 52% over the last 2 weeks, with nearly 5,000 patients hospitalized. On Sunday, the state reporting more new cases per capita than any other state in the country. Let's bring in Dr. Murtaza Akhter. He is University of Arizona College of Medicine, Phoenix emergency physician. And doctor, it's good to talk to you. I know you're under a lot of stress, especially as we've seen this spike in this state. What do you think has contributed to the kind of case counts we've seen in recent weeks?
Well, for one thing, it should be clear to everybody that herd immunity is bogus, right? We were clearly a very bad hotspot in the summer. For anybody who had the logic of, look, they're over it, clearly it doesn't work that way. We've been saying this for a long time now, that herd immunity is a terrible strategy, and now we know that it doesn't work at all. Once you're a hotspot, you can become a hotspot again, and repeatedly so. And so Arizona is having a ton of cases. Honestly, a bunch of the country is having a ton of cases right now. Arizona just happens to be one of the worst ones right now in the country, but it's not like anybody's doing particularly well. And it's just unfortunate that it has come to this. It has repeatedly come to this, and that people, and we know what it takes to beat the virus, and just people just aren't doing it. It's as if they've given up. And I think that may be playing a role. People gave up. They decided, you know what, I'm going to celebrate Thanksgiving and Christmas. And exactly what we predicted would happen did happen. So it's not even surprising. It's just really unfortunate.
Yeah, it kind of seems like that's been playing out in a lot of areas. As you said, I mean, Arizona was doing well. We had you on the show. We were talking about masks. It seems like that was moving in the right direction. And then you start to see cases come down. People start to loosen up, and you see the reversal like clockwork here. So, I mean, how much harder does it become to maybe get people back on board to say, look, we got to go back to the old way of doing things to really get this under control?
Yeah. I wonder if we're already past that stage. I don't know if people are thinking, well, I'm going to get vaccinated soon anyway, or if it really was, I just wanted to do what I needed to do for the holidays and people will start hunkering down again. I don't know. I have a little bit less faith than probably some other people. We had the answers. There are countries that have pulled this off, right? Taiwan doesn't have a vaccine. South Korea doesn't have a magical vaccine. Everybody's in the same boat, pretty much, especially when it comes to looking at the rich countries. But clearly, some of them were able to solve the issue. And it was without vaccination. It was by distancing and by wearing masks. So we've had the answers. We just haven't employed them. To think that we suddenly will in the next couple of months after almost a year, I'm skeptical.
And doctor, of course, all of this has been complicated by the slow rollout of the vaccine. We've seen this issue across the country, but Arizona's rate particularly low here. 1.5% of people inoculated roughly. What do you think has contributed to the slow rollout so far in the state? And how easy is it to correct things on the ground to pick up the pace a little more?
Yeah, well, as Dr. Fauci mentions, it's a little bit early to be able to say whether we've done it effectively or not. Clearly, we haven't hit the targets really anywhere in the country that we wanted to. And part of that is just based upon it's a new vaccine, and trying to get it rolled out that quickly is hard to do. You have to be able to not just have the product, but also to be able to deliver the product. All you guys in the business world know this, but it's true in healthcare as well. And so how do you administer the product once you have it? Right now, we've been following, at least in Arizona, sort of the CDC guidelines and trying to get the healthcare workers to be early vaccinated, the ones who are the most risk of getting COVID and dying from it to be vaccinated. And so how you sort of up triage that becomes the question at hand. Again, it's early in the course. So if Arizona is trailing behind the rest of the country, that may not be the case in a couple of weeks or a couple of months. But it would be really nice, as some people have mentioned, if we had a national coordinated effort, rather than every state doing what it wants for itself. Sometimes that works, but federalism clearly hasn't beaten the virus. And I don't think federalism will work for getting the vaccination out effectively as well. If there's a national coordinated response, which there may be with the new administration, then I think that would be a great step towards getting as many people vaccinated as effectively as possible.
And doctor, when you talk about those who are in that first group of vaccinations, what kind of resistance have you experienced on that front? We have heard nationally, at least, in a lot of nursing homes, for example, a lot of the employees just don't want to get inoculated because they're a little concerned about their safety.
Yeah, it's really appalling that people in the healthcare professions are saying and acting that way. I feel like I've been lucky, and the people I work with have been very pro getting vaccinated. I realize that it's a new drug. There are only so many data, but we know what the side effects of COVID are. That is known, and it's not good. The side effects are bad. People die, and the ones who don't die can have lots of long-term effects. We know that. So when you weigh that against the risks of a new vaccine, it seems pretty clear cut to me. I know of multiple colleagues who have other colleagues in their hospitals who are saying, I don't want the vaccine, which I don't know if you are, again, Taiwan and have basically no cases, then maybe it's okay to wait for the data. But when you're in a country like this one, and when you're exposed to patients, and when you're exposing yourself to other patients whom you can potentially infect, to say that, I'm going to hold off on getting a vaccine is a very aggressive measure. Sometimes there are reasonable reasons for it, but by and large, for people, especially in healthcare, to not be getting vaccinated, it is a little bit hard to comprehend.
Yeah, and Dr. Akhter, I mean, we talk about that skepticism on the vaccine front, perhaps also tied back to the skepticism around Americans maybe not believing in the effectiveness of wearing masks as well, maybe not wanting to focus in on the science here, but it is a bit of a kind of a strange picture to see so many people lining up and waiting to get vaccines, but also hearing a lot of people say, look, I don't want to get the vaccine. I assume at some point you're going to hit a break point around that, but I guess it boils down to the conversation we're having right now around the Biden administration looking to move in the other direction than what we have been and just getting as many doses out as possible beyond making sure that you're going to have the dose to follow up on the first dose of these vaccines. So where do you fall on that debate right now in just getting as much as you can out the door, considering you might eventually run into this issue of Americans maybe not wanting to get the vaccine?
Yeah, I think that actually is a nuanced point and a very smart question for a couple of reasons. For one, do we know if we will be able to build up and ramp up to get that second dose to people who get the first dose? President Biden, or President-elect Biden, is very confident that he can get the companies to produce a second dose, even if you get rid of all the first doses right now. But the other question from the scientific perspective is, how effective is one dose? We know the Pfizer and Moderna are a 2-dose regimen, but we really don't know how effective one dose could be. And I'll be honest, I was partially tempted to trial it on myself and just not get the second dose. Of course, I did what I was supposed to do. I got the second dose. But remember, when the trials were run, the second dose was given. And any data we have on just one dose efficacy from those trials is just based on those couple weeks between the first and second dose. And the first dose doesn't even take effect for a few weeks. So it's very possible that even the first dose is very effective. And there's reasonable scientific rationale behind thinking that maybe one dose is sufficient to give a good amount of protection. We unfortunately just don't know. But I think it's a reasonable strategy to say, well, maybe we'll just give one dose to everybody, with the caveat that Johnson & Johnson should shortly be coming out with a one-dose vaccine. So you don't necessarily need to rush out one dose of Pfizer or Moderna with the logic that this is all we'll ever have, especially if there are other vaccines that come out that might be one-dose regimens. So it's really a pros and cons argument, and there's no clear-cut right answer. The toughest problem is the people who, no matter what, just won't get vaccinated. That's the toughest problem, as well as the people who refuse to distance and mask.
Mm-hmm. Yeah, no, and all of those things becoming more and more important here until we see those vaccines come out to reach the mass public. Of course, masks and social distancing, as you're talking about there, still very important. But Dr. Murtaza Akhter, University of Arizona College of Medicine, Phoenix emergency physician, appreciate you coming on. I know you're very busy. Thanks for taking the time.
Thanks for having me, Zach.